Diabetes mellitus is a chronic medical condition. It occurs when the body cannot properly process glucose. Glucose is a type of sugar found in the blood. This happens because of problems with insulin, a hormone that helps glucose enter cells. There are different types of diabetes mellitus. Each type has unique features, however, they all share common traits. The body either does not produce enough insulin or cannot use it effectively. When insulin is not working well, glucose builds up in the blood. High blood glucose levels can cause many health problems. These include heart disease, nerve damage, and kidney issues. Understanding diabetes is crucial for managing it. This essay will break down the types, causes, symptoms, and treatments. It will also highlight the complications of untreated diabetes. Type 1 diabetes is an autoimmune condition. The body's immune system attacks the pancreas. The pancreas is the organ that produces insulin. Without insulin, glucose cannot enter the cells, leading to high blood sugar levels. Type 1 diabetes often starts in childhood or early adulthood. It is less common than type 2 diabetes. People with type 1 diabetes need to take insulin injections. This helps manage their blood glucose levels. Symptoms of type 1 diabetes can develop quickly. They include excessive thirst, frequent urination, and extreme fatigue. If not treated, it can lead to serious health issues. Managing type 1 diabetes requires a strict routine. This includes monitoring blood sugar levels and adjusting insulin doses. A balanced diet and regular exercise are also important. Type 2 diabetes is the most common form. It usually develops in adults over 45. However, it can also occur in younger people. It is linked to obesity and a sedentary lifestyle. In type 2 diabetes, the body does not use insulin properly. This is called insulin resistance. Over time, the pancreas cannot produce enough insulin. This leads to high blood glucose levels. Symptoms of type 2 diabetes develop slowly. They include increased hunger, unexplained weight loss, and blurry vision. Some people may not have symptoms at all. Managing type 2 diabetes involves lifestyle changes. This includes a healthy diet, regular exercise, and weight loss. Medications or insulin therapy may also be needed. Gestational diabetes occurs during pregnancy. It affects how the body uses glucose. It usually disappears after giving birth. However, it increases the risk of developing type 2 diabetes later. Gestational diabetes is diagnosed through screening tests. These tests are done between 24 and 28 weeks of pregnancy. It is important to manage it to avoid complications for both mother and baby. Symptoms may include excessive thirst and frequent urination. However, many women do not notice any symptoms. Regular prenatal checkups are crucial for early detection and management. Treatment includes a healthy diet and regular physical activity. Some women may need insulin therapy. Monitoring blood sugar levels is also important during pregnancy. Section 5. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. It is believed to be linked to genetic factors. Environmental triggers may also play a role. These could include viruses or other infections. In type 1 diabetes, the immune system mistakenly attacks the insulin-producing cells in the pancreas. This autoimmune response leads to a lack of insulin. Without insulin, glucose builds up in the blood. Family history can increase the risk of type 1 diabetes. If a close relative has the condition, the likelihood is higher. However, not everyone with a family history will develop it. Research is ongoing to understand the triggers of this autoimmune response. Identifying these triggers could lead to better prevention methods in the future. Section 6. Causes of type 2 diabetes. Type 2 diabetes is primarily caused by lifestyle factors. Obesity is a major risk factor. Excess body fat, especially around the abdomen, increases insulin resistance. A sedentary lifestyle also contributes to type 2 diabetes. Physical inactivity can lead to weight gain and insulin resistance. A diet high in sugars and unhealthy fats further increases the risk. Genetics also play a role in developing type 2 diabetes. Family history can increase the likelihood. Certain ethnic groups are at higher risk, including African Americans, Hispanics, and Native Americans. Age is another factor. The risk of type 2 diabetes increases with age. However, an increasing number of younger people are being diagnosed due to lifestyle factors. Section 7. Causes of gestational diabetes. Gestational diabetes is caused by hormonal changes during pregnancy. The placenta produces hormones that can lead to insulin resistance. This makes it harder for the body to use insulin effectively. Women who are overweight or obese are at higher risk. Excess weight can contribute to insulin resistance. A lack of physical activity also increases the risk. Family history of diabetes can play a role. If a woman's parents or siblings have diabetes, her risk of gestational diabetes is higher. Age is another factor. Women over 25 are more likely to develop it. Previous pregnancies with gestational diabetes increase the risk for future pregnancies. Having a large baby in a previous pregnancy can also be a risk factor. Section 8. Common signs and symptoms of diabetes. Recognizing the signs and symptoms of diabetes is crucial. Common symptoms include increased thirst and frequent urination. These occur because the body tries to remove excess glucose through urine. Unexplained weight loss and extreme fatigue are other symptoms. The body cannot use glucose for energy, leading to weight loss and tiredness. Increased hunger is also a common sign. Blurry vision and slow-healing sores or cuts can indicate diabetes. High blood sugar levels can damage blood vessels, affecting vision and healing. Numbness or tingling in the hands or feet is another symptom. If you notice these symptoms, it's important to see a doctor. Early diagnosis and treatment can prevent complications. Regular checkups and monitoring are essential for managing diabetes. Section 9. Diagnosis and treatment options. Diagnosing diabetes involves several tests. The most common test is the fasting blood sugar test. A blood sample is taken after fasting overnight. High blood sugar levels indicate diabetes. Another test is the HbA1c test. It shows average blood sugar levels over the past 2 to 3 months. This test helps in diagnosing diabetes and monitoring long-term control. Treatment depends on the type of diabetes. For type 1 diabetes, insulin therapy is essential. Type 2 diabetes may require lifestyle changes, medications, or insulin. Gestational diabetes is managed with diet, exercise, and sometimes insulin. Monitoring blood sugar levels is crucial for all types. Regular checkups with a healthcare provider are important. Managing diabetes also involves a balanced diet and regular physical activity. Section 10. Complications of untreated or poorly managed diabetes. Untreated or poorly managed diabetes can lead to severe complications. High blood sugar levels can damage blood vessels and organs. This increases the risk of heart disease and stroke. Nerve damage is a common complication. It can lead to numbness and pain in the hands and feet. In severe cases, it can cause digestive issues and sexual dysfunction. Kidney damage is another risk. High blood sugar levels can harm the kidneys. This can lead to kidney failure, requiring dialysis or a transplant. Eye problems, including retinopathy, can result from diabetes. This can cause vision loss or blindness. Managing diabetes effectively is crucial to prevent these complications.